So spotting between periods or sex might seem minor, but it could be your body's alarm bell. In this video, we'll explore how chlamydia can cause these symptoms and what to do if your body is affected. Left untreated, chlamydia does not go away. It actually gets worse, and the damage it can cause can be irreversible. Let's break down and get you answers. Hi, I'm Dr. Fuller, certified sex therapist and medical doctor. There are lots of signs to look out for chlamydia. Check out our complete playlist below so you can catch an infection early. What is chlamydia? It's actually a very common bacterial sexual transmitted infection. It often affects the genitals, the rectum, or even your throat. And it can also be asymptomatic, especially in women. If untreated in women, it can cause pelvic inflammatory infection, infertility, or complications in pregnancy. It's easily treated with antibiotics like doxycycline. What are the common symptoms of chlamydia in women? Common symptoms of chlamydia in women can range from abnormal vaginal discharge, burning during urination, lower abdominal pain, bleeding between periods or after sex, and sometimes some women have no symptoms at all. So regular screening with your physician is key. So why does chlamydia cause bleeding? So bleeding may be a sign of chlamydia if it occurs between periods, after sex, or after intercourse, along with any abnormal vaginal discharge or pelvic inflammatory pain. If bleeding is persistent or unusual, please make sure you consult your physician. So when is bleeding a sign of chlamydia? If you know that you're having unprotected sex and you have any abnormal bleeding, that is when you need to seek medical advice. So how is chlamydia diagnosed? So if you're unsure if you have chlamydia and you want to receive testing, it's so crucial that you go to your primary care physician and let them know that you might have symptoms of chlamydia. So you can get a swab test done, you can get an NAAT test done, aka NAT, or typically for men, you would get a urine sample. What are the treatment options for chlamydia? Chlamydia is treated with antibiotics, most commonly doxycycline. We typically will prescribe doxycycline 100 milligrams daily for 7 days. Erythromycin is another drug we use, 1 milligram orally as a single dose, for those who might not be able to take doxycycline. Both are highly effective, but it's so important for you and your partner to get retested so you don't get reinfected. You want to avoid sexual intercourse during this time and ensure that you schedule a follow-up appointment. So what are the complications of untreated chlamydia? Untreated chlamydia can have several severe complications. 1, pelvic inflammatory infection, infertility due to scarring in the fallopian tubes, chronic pain, especially in the lower abdomen. You have increased risk of HIV transmission. Early prevention will help prevent these complications. How do you prevent chlamydia infections? To prevent chlamydia infections, you want to 1, consistently use condoms. That is key. 2, you want to limit your sexual partners, or if you have multiple sexual partners, you want to ensure that you're getting tested every 3 months. You want to communicate with your partners about your STI history. Prevention is key. To stop spreading chlamydia, you have to practice safe sex.